Learning that you have high blood pressure can come as a shock, since a condition typically has no symptoms. The good news is that some lifestyle changes can help lower blood pressure and reduce your risk of complications such as a heart attack or a stroke. Your diet can also affect your blood pressure, either positively or negatively. There are several things that you can do to lower your blood pressure right now. And please remember to be sure to subscribe to my channel because it helps me make more videos just like this. A healthy diet with lots of fruits, vegetables, whole grains, nuts, and seeds is important for your heart. Some of the top foods that are high in nutrients and low in sodium are olive oil, flax seeds, salmon, and a lot of variety of fruits and vegetables. So eating these foods can help you lower your blood pressure naturally. Eating a well-balanced diet is key to lowering your blood pressure. Omega-3 rich fatty oils like olives and flax seeds are top foods to include in your diet. Additionally, make sure to limit sodium and saturated fats for optimal health. Healthy omega-3 fats like eggs can also help reduce cholesterol levels and lower your blood pressure as well. Flaxseed oil is also beneficial for helping clean out the arteries and lower blood pressure. And make sure to include plenty of vegetables and whole grains into your daily routine for optimal health benefits. Eating a wide variety of healthy foods can help you reach and maintain a healthy weight, stabilize your blood pressure, and improve your heart health. Eating saturated fat in moderation is key to keeping your blood pressure low. Foods that are high in fiber and protein, such as nuts, beans, and seeds, are good sources of potassium, which can also help lower your blood pressure. Many nuts and seeds are rich in healthy fats that can help keep your blood sugar at healthy levels. Sunflower seeds are also packed with healthy plant fats, including soluble fiber, which will help lower cholesterol. This type of fat is known to reduce the risk of type 2 diabetes and is associated with improving vessel function to lower your blood pressure. Lean meats such as poultry and fish are also beneficial for lowering blood pressure. So even a small reduction of sodium in your diet can improve heart health and reduce high blood pressure. The effect of sodium intake on blood pressure varies among groups of people. In general, limit sodium intake to 2,300 milligrams a day or less. However, a lower sodium intake is ideal for most adults. Consuming unhealthy foods, such as those high in sodium, can have an adverse effect on your blood pressure. Drinking alcohol can also increase your risk of developing high blood pressure. Per the American Heart Association, they recommend that men limit their alcohol consumption to no more than 7 to 13 drinks per week, and women to no more than 7 drinks per week. Many studies have found that moderate alcohol consumption can reduce high blood pressure. Cardiologists also recommend reducing stress and other behaviors that contribute to high blood pressure. Getting adequate sleep is another important factor for reducing hypertension and improving your overall health. Studies have linked calcium-rich diets to reducing atherosclerosis risk factors. Atherosclerosis is a buildup of fibrous and fatty material inside the arteries, and over time, arteries can become clogged due to the buildup of plaque, which is a material consisting of fats, cholesterol, and other substances that stick to the artery wall. Plaque prevents the free-flowing movement of blood and oxygen throughout the heart muscle and to the rest of the body. A blockage in the artery deprives the heart of blood, oxygen, and the nutrients the heart needs, causing a part of the heart muscle to die. The blood flowing over the top of the plaque can clot, causing a blockage in the artery that can result in a heart attack, or it can be carried downstream, causing a stroke. Once the plaque gets to a certain size, the artery can become so narrowed that insufficient blood gets through, which can cause pain or discomfort, usually during exercise. With severe blockages, doctors may perform surgery called a heart bypass to make sure the blood can get around the obstructed artery. There are studies that have shown calcium supplements may help lower blood pressure, but eating calcium-rich foods like berries may be a better option. Blood pressure often increases as weight increases, so being overweight also can cause disrupted breathing while you sleep, which further raises your blood pressure. If you are overweight, losing even a small amount of weight can help reduce blood pressure. Also, the size of the waistline is important. Carrying too much weight around the waist can increase the risk of hypertension. Regular physical activity can lower high blood pressure. It is important to keep exercising to keep blood pressure from rising. And as a general goal, aim for at least 30 minutes of moderate physical activity once a day. For those who have hypertension, regular exercise can bring blood pressure down to safer levels. Some examples of aerobic exercise that can help lower blood pressure include walking, jogging, cycling, swimming, or even dancing. Another possibility is high-intensity interval training. This type of training involves alternating short bursts of intense activity with periods of lighter exercises. Strength training also can help reduce blood pressure. Aim to include strength training exercises at least twice a week. Make sure to speak to your healthcare provider about developing an exercise program. Getting fewer than 6 hours of sleep every night for several weeks can also contribute to hypertension. A number of issues can disrupt sleep, including sleep apnea, restless leg syndrome, and general sleeplessness. Make sure to inform your healthcare provider if you often have trouble sleeping. Finding and treating the cause can help improve sleep and your blood pressure. Chronic stress is unhealthy for your heart. This is true even for people without any pre-existing conditions. In several studies, researchers found that the doubling levels of cortisol alone was associated with a 90% higher risk of having a cardiovascular event. Cortisol is a stress hormone that drives your reactions to danger or threat. When the issue has passed, your cortisol is supposed to drop once again. That is what lets your body and brain know all is safe. Norepinephrine, epinephrine, and dopamine all work together to regulate the autonomic nervous system and control involuntary body functions like your heart rate, blood pressure, and your breathing. As a result, heart health could be compromised without a person really realizing it. So to lower your stress, plan your day and focus on your priorities. Make sure to focus on any issues that you can control and make plans to solve them. Avoid stress triggers. For example, if rush hour traffic causes you stress, travel at a different time or take public transportation. It is really important to make time to relax. Make time for enjoyable activities or hobbies, such as taking a walk, cooking, or even volunteering.